Good morning, everyone. It's time to begin the webinar. My name is Gábor Balázs. I am the Managing Director of MUTK, which is the Hungarian Knowledge Center of Urban Studies. And we participate in a Horizon project called WELLBASED, and this is the webinar of the WELLBASED project. So I share my screen first. Yes, I hope everybody see this. So our webinar is today about financial schemes and other kind of financial interventions which help us to tackling energy poverty and health issues. For those who are not familiar with WELLBASED project, which I guess is not so many in the webinar, but some of you maybe never joined us before. This is a Horizon 2020 program, which is aiming to put health perspective on the debate of energy poverty. What we are doing is that we have 6 pilot cities where they implement and we evaluate the comprehensive urban programs, which is aiming to reduce energy poverty and its effect on the citizens' health and well-being. And based on this concrete research, we try to provide evidence and some knowledge on the policy measures for local, national, and European level. This is what the WELLBASED project is about. It's a consortium of different research institutes and, of course, cities. And you can have more information about WELLBASED in the wellbased.eu website. So what is this webinar about today? We will discuss financial models, first in general, framework of this question, and then 2 concrete interventions or 2 concrete tools on these financial issues. You can see the agenda here in the screen. First, my colleague András Varró will speak a little bit about the general findings of financial models. Then we give the floor to Joram Nauta from TNO, and he will introduce a very interesting model helping us to quantify and measure the financial consequences of different interventions. And finally, we will discuss the issue of social impact bond with the help of Rebecca Lucas from Carocci. So this is the menu for today. And now I guess I will give the floor to my colleague András Varró to have the first presentation. Floor is yours, András.
Thank you. Okay, can you see my screen?
Yes.
Okay, thanks. Welcome everyone. I am András Varró from MUTK, and in my presentation I am going to introduce one of our deliverables on existing and alternative financial models. I'd like to give an insight into what we have done, why, and into the content of the deliverable. Sorry, I can't move my slides. Excuse me just a second. Still can't move it. So I'm going back to the previous version. Can you see it now?
Yes, we have seen it.
Okay, sorry for the inconvenience. So
we had a question. The PPTs will be available for the participants of the webinar.
Yes. So is the recording of the session?
Yes.
Yeah. So our main goal with this deliverable was to review and analyze financing models applied to tackle energy poverty within the EU and its surrounding countries. We wanted to examine how they operate under the current social economic circumstances, what are the main barriers and what are the facilitators that support their functioning. The study consists of three main parts. First, we present the theoretical background and history of financial models, and there are two different analyses on social impact bonds and urban financial metabolism, which will be presented right after my presentation. First, we carried out desk research, we reviewed the literature, then we used different well-based events to collect best practices from professionals and practitioners, and two primary researches are also included in the study on SIB and UFM. This is a public deliverable. It will be submitted in December. So once it is approved, it will be available for everyone who is interested. Now let's move to the content of the topic. So as you probably all know, energy poverty negatively affects the quality of human life in many ways, and WELLBASED is focusing on the health aspects of energy poverty.
Sorry, András, we cannot see your PPT, only the first slide.
Let me stop it. Okay. I'm going to share the original version because I don't know why it doesn't work. Can you see it? It's
yes, in
okay.
Scrolling mode, but yes.
Sorry for that. Other deliverables in WELLBASED explored the connection between health and energy poverty. So we know that energy poverty can be associated with several health risks, because inadequate comfort and sanitary conditions in housing contribute to lower productivity, health problems, and higher mortality and morbidity. And due to the climate change, energy poverty poses threat to energy during the summer as well, because people suffer from the consequences of the heat waves. So the healthcare costs deriving from energy poverty are growing, and so is the need for available financing to tackle this problem. It seems that...
Sorry, András, we cannot see it in full screen mode.
Yeah, because it didn't work, I'm sorry.
Okay, that's fine. We can read it.
I couldn't move my slides somehow.
Okay.
Sorry. So it seems that policymakers recognize this growing demand as well. In the updated recommendations on energy poverty by the European Commission, it is emphasized that there was a sharp increase between 2021 and 2023 among the households who were unable to keep their homes adequately warm during the winter. And this share more than doubled in the lower income categories. And they also recognize that households affected by energy poverty have limited access to commercial loans, and they face barrier to access finance for investments. Therefore, they need public financial support. According to the Commission, this financial support can be either a direct upfront subsidy, direct payment of the energy efficiency works, a public loan, or zero to low interest loans. Energy Efficiency Directive declares that a required amount of energy savings should be achieved among people affected by energy poverty. And in the meantime, the renovation wave strategy has been launched, and it mobilizes renovation strategies to handle energy poverty. Social Climate Fund allocates specific financial resources to member states to tackle energy poverty in the most vulnerable groups. And the EU4Health program is also worth to mention because it offers unprecedented financial support from the EU in the field of health. So it seems that political will has been born on the EU level, and there are specific funds to tackle this problem. According to our research, different possible categorization exists regarding the financial models. In one of the cases, we can talk about non-payable rewards, such as grants, subsidies, debt funding, and equity funding, and we can create further subgroups according to the degree of their market penetration. And in one of the other cases, we can talk about ESCO financing, customer financing, and third-party financing. These different categories are best suited to different groups and households. Grants and subsidies are best suited to vulnerable or low-income households and hard-to-reach properties, while loans are best suited to households with sufficient credit, and equity funding is best suited to large condominiums. Energy efficiency obligations and tax incentives are the ones which are well suited for all kinds of buildings and households. We can say for sure that there is no universal solution to tackle energy poverty. The energy poverty can be recognized either as a social or energy-related issue, and this choice determines the type of the policies which are put in place by policymakers. So if we provide financial aid as part of social policy, the competition will be less distortive and most vulnerable households will be affected, which is an advantage. But on the other hand, we will heavily rely on public expenditure. If we consider energy poverty as an energy policy issue, the effects will be more positive on the environment and health costs. But on the other hand, we will face the problem of targeting and the possible exclusion of vulnerable households. So we have to be aware that different solutions target different problems, and these paths must be recognized by policymakers in order to choose the right policies. Obviously, financial models face barriers, and financial barriers are the most common ones according to the result of previous researches. But awareness and access barriers are also important. This means the lack of technical knowledge and information regarding energy efficiency. And we also have to mention the geographical and regulation barriers. The case of condominiums or blocks is special because retrofitting activities in this type of buildings require a collective decision-making approach, and because of the diverse characteristics of the residents, this can make the things a bit more complicated. Targeting of the subsidies is also a possible barrier, because if they are not targeted, subsidies tend to be taken up by households who do not fall in the lowest income groups. There's a barrier regarding the upfront financing and complex administrative procedures, which may hinder such households to access these fundings. And there is a risk that the insufficient amount may reduce the depth of the renovations. And we also have to mention that national definitions of energy poverty and the concept of vulnerability is also missing in many cases. And on the other hand, financial institutions face barriers as well. So after we present the theoretical background of financial models, we present a couple of good practices. We were looking for innovative existing practices where target groups are well defined and multiple stakeholders are involved. And then we introduce these models in the same format. So this selection is based on a subjective basis according to the publicly available information. And we found that the quantity of information is not homogeneous and limited. And this is in line with the result and the experiences of previous similar researches. So we selected models which are applied in Europe, include the targeting of low-income households and direct financial assistance, either for the consumers or social service providers. And it was important that health, well-being, and social aspects are taken into consideration. We found that the existing models are mostly energy and cost focused, and health impacts are marginal in the evaluations of these programs. So here's our selection of the good practices. As you can see, we selected 6 examples, and in this table, examples from Western Europe are overrepresented, but there's also an example from outside of the EU. And the examples also differ by their geographical scope. There are programs which were applied on country level, and there are local and regional programs as well, and also differ by their leading stakeholders. Some of them were carried out by NGOs, some of them by municipalities or SMEs. And as you can see, the importance of health and the quantity of data on health is also different in the cases of these examples. And based on our research, we also created a kind of typology along 2 dimensions. One of the first dimension is the focus of implementation, which can be a renovation, financial assistance for energy costs, or financial assistance to cover health expenditures. And the other dimension is the funding, which can be public, private, or mixed. And according to this categorization, we can distinguish 9 different types, but we can create further dimensions. So we can extend this table with further dimensions, such as the geographical scope or the type of leading stakeholders. This was the brief summary of our study. Thank you very much for your attention, and I'm looking forward to your questions after the presentations. Thank you.
Thank you, András. As it was set in the agenda, we have 3 presentations now, and after the 3 presentations, we will have the Q&A sessions. So if it's fit to you, then we will discuss what András presented now, and you can ask or raise questions in the Q&A button, under the Q&A button in the Zoom platform. Now it's time to give the floor to Jan Nauta from TNO, and he will introduce an interesting model for quantifying what kind of benefits and costs raise in a case of intervention. Joran, floor is yours.
Thank you very much. Good morning to everybody. I hope you can see my screen.
Yes, we see.
Oh, very good. Thank you very much. Well, I will take a deep dive into one of the projects that we have developed over the last years, show you some results and examples of actually how the whole financial metabolism of a city is changed as a result of energy or risk of energy poverty. I will first introduce a little bit about the energy poverty and the relation to other domains, and then tackle the idea of urban financial metabolism before I explain this example. And at the end of the presentation, I will show you some conclusions of how energy poverty is affecting all types of other fundings and streams in a city, and how you can capitalize on that for your energy poverty projects, as we show. We have been inspired by a study that's been done by the University of Groningen, TNO, myself, the New Energy Coalition, and the City of Groningen, where we explore this concept. So I will show you some of the results of that. So first, go into the idea of energy poverty and urban financial metabolism. And I think I start by saying that I think we all understand that when you start to transform neighborhoods to become more sustainable, it's not only about technology and the technical interventions. It's a social fabric and the financial fabric of those neighborhoods and areas that you need to take into account as well. And of course, it's not only a personal business case where costs and benefits are weighted, but it's also a societal cost-benefit analysis that helps. And we understand from our studies that not being able to participate in energy transition will leave people alone without houses that are still not insulated because of the energy cost price increasing, the risk of energy poverty gets on. So the whole idea was that maybe the cost of doing nothing eventually may outweigh the initial extra costs that you spend to actually transform those houses to become more sustainable. So that was the start of the study, where we said maybe from a societal perspective, it's better to invest rather than take the consequences of not investing and doing nothing. And let's see how that develops. And I will help you with this, because we understand from our studies and in WELLBASED that energy poverty is restricting households on many different levels. They cannot participate in society. They have all kinds of challenges, not only in health, but also in participation in society itself. When you look at areas where cities actually spend their money and how it relates to energy poverty, you see that in all types of departments of city planning, there is a link that can be made towards energy poverty that has been described in literature and theory, and we also see it in practice. So if you look into public order and safety, for instance, we understand that energy poverty increases the likelihood of experiencing physical violence. So there is a way to public order and safety. And if we increase the amount of people, for example, that are at risk of energy poverty, we might end up with other municipal departments that need to come into action as a result of energy poverty. And you can see there are other areas where energy poverty actually, in the end, activates other departments in your municipality. So what have we done? We try to really take a deep dive into understanding the causal mechanisms, so the cause and effect chains that actually happen when people are experiencing or at risk of energy poverty, and how that affects municipal expenditure. And we've taken a specific view on that. We've taken the urban financial metabolism view, which I will dive into later, to understand and to study how flows of money and activities are actually being redirected in cities as energy poverty, the cost of doing nothing. If energy poverty increases, which other activities and actually money that is being that's being drained of sources because of energy poverty is being reused in the city. So why taking urban financial metabolism? For us, it was a tool to analyze and to visualize how money is flowing from different departments in the city budget towards neighborhoods and towards activities in those neighborhoods. And it gives you an idea of how money is being spent from a municipal budget into different neighborhoods, and what changes if you decide to invest early in preventing energy poverty, and what happens if you don't do that, because then we've shown from the theory that other municipal departments actually have to come into action and have to spend more. That was our assumption. So actually understanding how finances work, how finances are being directed from a city hall towards individual neighborhoods, and how much money is being spent on individual programs, helps you to understand why money is being invested in those programs and how it tries to influence certain outcomes, how it prevents public order issues, or how it prevents people not going to school or in social isolation. And once you start to understand how these systems work, you can also influence it. And that's what we try to do, and bring these insights back to the municipal departments and show how they also have a part to play and how energy poverty is affecting their budget in future if we don't take action today to prevent energy poverty. The urban financial metabolism uses causal chains. And once you start to understand how the causal chains work, then you can also understand how you can influence them. So we've tried to build on making causal change in these areas. To understand the concept of causal change, you basically end up by seeing how money is being spent on which activities, And these activities are, of course, being organized because there are certain needs. And these needs have arisen because certain situations are going on. So once you understand what kind of drivers there are, then you understand the needs of your citizens, and you start to develop activities, and you have to spend money from your municipal budget towards these activities. That's the idea of how causal chains work. And once you start to understand how these work in cities, then you understand how you can actually help identifying how much money is being spent where, and if something changes and you start to invest in preventing energy poverty, how it affects your budget in other programs as well. So what we've done in this case is in the municipality of Groningen, we've taken a real in-depth case study in the municipality of Groningen, where we have used a combination of concepts to actually work with the city people, with the coaches, with the people that walk through these neighborhoods and say, hey, actually, what happens here if energy poverty is really doubling or tripling? How would it affect certain areas of your work, on your budgets? How much more money would you require to do your work in a better way? We've looked into the municipal budget. How is money being spent? Where is it being spent? And in a hypothetical case that energy poverty doubles, which of your budgets would be affected because of things changes in your neighborhood? I mean, people have no money to do the gardening or to paint their homes or take activities in go to sports or participate in other volunteering events because they might feel ashamed or they might have different things. So we've really took a deep dive into the municipal budgets. We said, hey, guys, listen, a lot of your programs are being affected. And you can see here all the gray programs and the size, the size of the, it tells you also how much money is being spent there. Almost of these 14 programs, a lot of these programs are being affected or we think are affected. So once we understood where money is being spent and we started to understand with these people how would these causal chains actually work? What would happen? Which program then is affected? How much money is being spent in that? And we started with the drivers. Then we said, hey guys, how does this affect your local government spending? And how much is this affected when energy poverty doubles? What are individual needs? What are community needs that have changed? And what type of activities would you in your program then have to do to actually help intervene with these circumstances? And what you see, and this is an example of one of the financial flows in the budget of work and income. We see that the drivers are energy affordability and energy efficiency. And we understood by talking to the people that run these types of programs, there's debt management support required. They need help with cost of living in terms of energy efficiency. Housing quality is affected. And you see that there are the needs and then are the drivers. Hey, these people go to your office, to the municipal debt office and ask for more support. They ask all types of different, so these needs have consequences. And for those consequences, the municipality actually has a part to play. So you see a lot of activities that are being asked from a city. Of course, we understand today that these activities are already there, but we also can now see, hey, these programs might require more and more and more money in future when we don't intervene today with people at risk of energy poverty or already in energy poverty. So showing that energy poverty is not only a problem in terms of energy costs, we can also now show, because of we following this causal change, that it affects other municipal programs as well. In the handout, I will give this slide because you can see there are a lot of causal change at work at the same moment. We put it in the deliverable as well, but I will put it in a separate handout in the sheet, because there you see how it is all connected and intertwined. But you see that we've looked into 5 budget lines of the municipality that don't have anything to do with the energy transition, but are affected because of the energy transition coming to a halt. And if we don't tackle the problem of energy poverty today, in future, these 5 programs will be affected because of things that we haven't done and we're not solving today. So by introducing this concept, we've shown you that energy poverty interlinks with a lot of other municipality programs and budgets from a city. It has a broad financial implication on different local policy areas. It can aggravate already existing problems or complicate other issues that also need to be solved at the same time. And it increases the demand for local services that are being provided by the municipality. And this insight has led the municipality of Groningen to actually invest at the front to prevent people that are at risk of energy poverty or are already in energy poverty. They have started to understand that it's not only about solving energy poverty today, but it's also preventing that in future a lot more demand for services are being asked from the municipality. So it helps them save future money, I would say, because of tackling these issues today. So actually, the cost of doing nothing, we've shown, are by far larger over a period of time than actually solving the problems today. And basically, they have now installed a fund for people at risk of energy poverty. So then we can now, I think, follow on to the next speaker that actually introduces how you can distribute the money. I think that's an interesting handover, I would almost say, to Rebecca, and saying that this was really worthwhile to do in the city of Groningen. And I think it might inspire others as well to understand why tackling energy poverty today is a good thing to do. So with that, I will leave you, and we'll take your questions happily after our presentations. And I would almost say we put in the reference as well. And thank you very much for your attention, and I hope to answer your questions later. Thank you very much.
Thank you, Joran, for this fantastic presentation. We will discuss your questions or the questions to your presentation after the third presentation, which is now, the floor is to Rebecca Lucas from Cavalocci, and she will introduce how the financial bond, the social impact bond, could help us in finding the financial or coping with the financial limits of such programs. Rebecca, the floor is yours.
Thank you, Gabor. Hello, everybody. Good morning. And I hope you can see my screen. Please confirm that it is okay.
We can see it, yes.
Yes? Fantastic. Thank you very much. So this morning, I want to introduce you to the social impact bonds. And we will try to answer together the question whether they are new instruments to finance these energy poverty interventions. So I'm not going to spend any time saying how important energy poverty is and how important interventions to fight energy poverty are, because we know, and we've had lots of projects, and we have lots of seminars and millions of things and millions of data. So we know that these interventions to fight energy poverty are necessary and are also urgent. So what is the current situation today? The current situation is that we have high demand for energy poverty interventions, but we have a very low or at least scarce supply. And why is this happening? And there are two reasons for this. First, because we have that governments all over the world are facing fiscal constraints. And this implies the reduction of social programs. What is this? That governments don't have any money left. And we also have that in cases where we find interventions to fight energy poverty, they are very small interventions and they are sporadic. They are just maybe one-off interventions and they target very few people. We have pilot interventions of 100 or even less beneficiaries. So we need bigger interventions. So what are the key questions that we are faced with today? How can we finance these necessary energy poverty interventions? And is there a role for private investment or maybe for public-private collaboration? And then the other question is, how can we move from these small intervention to bigger ones? How can we scale up these interventions? And the answer that I want to see with you today is that maybe there is a new family of a mechanism of instruments which are called social impact bonds, and this can be a possibility to increase this investment in social programs, and it's going to be done through private financing. I don't know whether you are familiar with social impact bonds, but since these are new instruments, let's go through these briefly. What are social impact bonds? So what we have is we have new and alternative instruments to finance interventions that address what? Serious social challenges. And as we said, in a context of public-private collaboration. So what we have in ASIP is we have different actors. We have social investors that provide capital to finance social programs. And these social programs are usually carried out by NGOs. Here, just one thing about social investors. Who are these people? They are investors who care about their financial returns, but they also care about social outcomes. So if we had like two extremes, on the one side, we will have like the private investor caring only for their financial rewards. We will have, let's say, let me use this expression, like the Wall Street investor. On the other side, maybe we will have only people caring for social outcomes. We will have philanthropists. So in this space, we will have the social investors. The social investors are people in the middle of this continuum. They care about their financial rewards, but they also care about their social outcomes. So they are providing upfront capital to finance social programs. Then these social programs are implemented. And if the program is successful, what does it mean that it's successful? That certain outcomes that have been predetermined are achieved. Then if this happens, the public administration pays back to the social investor their initial capital plus a financial return. So the idea, the nice idea about the social impact bonds is that the public administration pays only if the intervention is successful. What does it mean? That all the risk of the intervention is transferred to the investors, because the public administration will not pay if the intervention is not successful and certain results are not achieved. So this means that there is also a guarantee in the use of public funds. Why? This is more efficient. Why? Because the public administration will only pay if the interventions are successful. Here it comes a word of caution. Why? Because when we talk about social impact bonds, we tend to think of bonds in the sense of debt instruments in the conventional sense. Bonds. No, they are not bonds. They are just contracts. They are pay for success contracts. So maybe this term of social impact bonds, the term bonds is misleading. Remember, it's just pay for success contracts, not bonds in the conventional sense of the debt instruments. And what do we have here? We have the main actors of the social impact bond. We have a commissioner, who is usually a public sector, a central government or local authorities. Then we have the investors. We said the social investors, they care about financial returns, but also social outcomes. And we may also have an intermediary because the social impact bond is a new instrument, it's complicated, so it's not easy to implement. We have the service providers. They will deliver the service to the target population. Here it's the people in energy poverty in our case. And then there will be also an independent evaluator who will check whether that intervention on the target population has been successful, if certain predetermined results or outcomes have been achieved. And if this is so, then the commissioner, the public administration, will give the money back to the investor, their principal, plus their return on investment. So we see here that we have the cooperation. It's a new form of cooperation between the public sector, the social service providers, and the financial actors. What are the advantages of the social impact bonds? As we said, we can have money to finance social programs. We can transfer the risk to the investor. Why? Because if it's not successful, the public administration will not pay the investor. We can scale up pilot projects, so we can move from small projects to bigger ones and then having more effect on the needy populations. Then we also have the efficiency in the management of funds. Why? Because only things that are proven, that are successful, are going to be financed. The promotion of social innovation, the rigor in the provision of service, and most importantly, the measurement of their impact. And also we will have an evaluation culture within the public administration. Are there disadvantages? Of course, there are disadvantages. Why? Because social impact bonds are still very new instruments and they are unknown. They were first launched in the UK in 2010, so it's just 14 years ago, and this is not enough time to check and to test the instrument because they are still unknown and they are being under proof, let's say. And then it's also complicated because they require the collaboration of different actors. We saw it in this previous slide, the public administration, the investors, and the service providers. And maybe these three kind of factors, they are not used to working together. Also, the SIB instrument is costly and it's complicated. There are management costs of the instrument, and the management is not easy. And also because the return on investment when we talk about social services may create some kind of perplexities. But let's see, as I said, they were launched in 2010, and since then they have had a great expansion. Now there are almost 250. Well, we have 240 social impact bonds, and then to have another 19, they are called development impact bonds, but they are social impact bond bonds in less developed countries. So they are the same. So we have 250, and the first one was introduced in the UK in the area of criminal justice, and ever since they have spread in many countries, across 40 countries, but they are mostly concentrated in the UK and in the US. Where are their areas of intervention? The first one was in criminal justice, and they have continued to be in criminal justice, some of them also in social welfare, also in the area of employment and job training, education, healthcare, and lately homelessness. And the interesting thing is that they have never been used in the field of energy poverty. And as we saw before and in the previous presentations, also in the one made by Andras, energy poverty has been mainly dealt with through loans and subsidies. So social impact bonds have never been used there. So our question is, can we social impact bonds be used to finance, but most importantly, to scale up interventions to reduce energy poverty? So if we think about it theoretically, it can be something very interesting, because they offer many opportunities. And one of the most important opportunities is that there will be an opportunity to invest in prevention, which in energy poverty it's extremely important. Why? Because it will avoid energy poverty from becoming a more serious and, what is more complicated, a chronic problem. So that will be great if we can invest in prevention and avoid this energy poverty problem from becoming a chronic problem. Also because they are an opportunity for the public administration to have capital, to have upfront capital to finance the intervention. And this money will be returned, will be given back to social investor only if the intervention is successful. And and some targets have been achieved. So this, as we said before, in the beginning, in my first slide, there is the possibility to tap into private sector funds when we have that public resources are scarce. Governments don't have any money, but they have competing demands, because the needs of vulnerable people are growing and growing over time. So again, the transfer of the risk of the intervention to the investor is one of the major advantages, and to move from pilot projects to larger projects, and also increase the number of beneficiaries and increase the impact of the intervention. And this will also allow for monitoring of the intervention, allowing for adjustments if they are necessary, and also encouraging transparency and accountability. And the important thing is that this will be done through data collection, measurement, and reporting. So what have we done in WELLBASED? What we want to check is if social impact bonds could be used to finance the interventions like the ones that have been deployed in WELLBASED, not to finance, but also to scale them up. And for that, we have taken an example. We are going to do this business case with the Valencia pilot, and we will see in a simulation, but taking into account the results that we obtained from the Valencia intervention, if this will be possible. And for that, we are going to carry out a pre-feasibility analysis. And we have carried out a compliance check and a business case. What do we mean with a compliance check? This is something that it's important to do. Why? Because not all interventions are suited or suitable for a social impact bond to be implemented. So they need to comply with certain conditions. And we will see if the Valencia pilot case complies with these conditions. And then the business case. The business case is just an idea of the economic model, let's say the cost associated to the energy poverty problem and the potential savings and costs that we will have to face. So having said that, what we have is that just a reminder, the intervention in the Valencia pilot, we can say that what it was carried out, that we had like energy audits carried out in the Valencia pilots. They were also the delivery of energy efficiency kits, bill optimization advice, and coaching. And we did a compliance check, and we saw that this intervention fits with the social impact bond requirements. Why? Because the problem of energy poverty is well defined, and its resolution is a priority for the public administration, in this case for the local authority in Valencia. The costs incurred by the public administration due to the energy poverty problem can be quantified, and we will see it in the next slide. The costs that will be avoided and the future savings for the public administration if this problem is solved can also be quantified. The beneficiaries are identified and limited. There is empirical evidence on the impact of the intervention. The results of the intervention can be validated and are also measurable. And there is also an ecosystem of agents that are ready and that could carry out the implementation of the social impact bond. Then, just for you to have a look and just to give you an idea of what we have done. We have calculated, estimated the costs and the savings of the application of the social impact bonds as if the intervention in Valencia were to be upscaled up to 1,000 beneficiaries. So what do we have here? We have that the cost of the energy problem are well defined, as we said in the previous slide. These are the costs incurred by the social service department. What we have is that when people in energy poverty cannot pay for their bills, we will have the social service department paying for their bills in total or part of them. So just in 2022 in Valencia, the social service department spent 348,000 euro in payments for electricity bill to people in energy poverty who could not pay their own bills. So this amounts to a total of 320 euros per beneficiary. If we calculate, imagine that we had a time period of 6 years, and imagine that we will have a constant spending by the social service department, which is not true because this is a very conservative assumption, because usually costs will vary. It may probably increase over the years, but just being conservative, if we take the amount spent in 2022 after 6 years for 1,000 people, we will have almost 2 million spent on paying energy bills by the social service department. What do we have also here? We have the savings in electricity bills. We have that the data from the Valencia intervention in WELLBASED revealed that after implementing the intervention to the intervention group, there are savings in the electricity bills, and these electricity bills amount to 38 euro per month. Again, imagine that we will calculate the average savings in electricity per year, and that we had 6 years, and we will have, for instance, in the first year an amount of more than 400,000. You will see that after year, these savings decrease. Why? Because we have to take into account the loss of good habits. At the beginning, things are done very well, but then as time passes, maybe we can lose some of these good habits. So probably the savings may decrease over time. So we have the cost of the energy problem incurred by the public administration. We have savings if we apply, if we have interventions. Imagine also, here we have the cost of the intervention. And we have calculated that the cost of the well-based intervention in the Valencia pilot was around 1,155 euro per beneficiary. Imagine that we had like 1,000 beneficiaries, and that we will apply a SIB, a social impact bond instrument. So we will have average cost of the well-based intervention for 1,000 beneficiaries, almost more than 1 million. Then we will also have the cost of the SIP structure, which are calculated as to be 20% of the cost of the intervention. This is because the SIP structure is complex and it needs to be managed and it has a cost. Then there will also be monitoring and evaluation costs, and there will also be the return on investment, which has been calculated at 4% annual rate. So at the end, we will have that the cost of the intervention, an intervention in Valencia for 1,000 people using a SIP instrument will be 1.7 million euro. So if we can make some calculations. So what will be the cost of the well-based intervention in Valencia with the SIB? So what we will have in the first year, we will have the cost of the intervention financed via SIB, which is 1.7 million euro. And then we will also have the cost for the social service departments in terms of payments of electricity bills. What is this? This is what the social service department will have to pay without the intervention, minus the savings in electricity bills thanks to the intervention. What happens here? That since the savings in the electricity bills are bigger than the amount paid by the social service department, this amount is negative for the social service department. So we don't take into account the negative amount. So what we say is that the cost for the social service department is zero. There no cost, while the remaining amount, there are still savings for the families. And what we have is that if we consider the cost of the intervention with the SIB in the first year, and then we have zero costs for the social service department. Why? Because the families themselves can now pay for their own bills. So we don't have the social service department to pay. The social service department does not have to pay for their bills because they can do it themselves. So what we will have here with this simulation is that after 6 years, the intervention with the social impact bond will be paid off, and there will be still a remaining saving for the social service department. And then from year 7, it will be only savings because everything has been paid back. So this was just to show you this example with some figures, but the important thing, and I think the interesting part is that the intervention could be scaled up using this social impact bond, and this will lead to obtain these savings for families that are created because of the reduced electricity bills. This is thanks to the intervention. Also, there will be savings for the social services department in terms of citizens' bills payments, because they don't have to pay for their bills because families can pay themselves. And also we will have that the total cost of the intervention with this SIP could be covered after 6 years. So in this situation and in this scenario, what we can say is that SIPs could be considered as an alternative new instrument that is at disposal of local authorities to scale up and finance interventions that combat energy poverty and increase the well-being of citizens. And this is the end of the presentation. And
Thank you, Rebecca.
give the floor to Gabo. Thank you.
Thank you very much for this presentation, also. And now it's time for discussion. All of the participants have the right to share their questions and thoughts in the Q&A session. You can see a Q&A button in the bottom of the screen, or you can put some question in chat as well, and or comment in chat, and we can do that. So first of all, we get a comment from Eva Schwab. Is working for the Faranza Association. And she raised that they are advocating for the renovation of the worst performing buildings as a measure to reduce energy poverty among the most vulnerables. They are very interested in concrete data on public expenditure that can be saved if these renovations will be financed. And she showed that one of the report they put. It's very long chat, so I have to open my screen. So they have documents in this question as well, which shows some interesting results. In 2016, this was Eurofund study. When they find that the cost about 295 billion in 2011 prices, the annual cost to the economy of the EU of leaving people living in inadequate housing is nearly 195 billion. And this could be paid back for 1.5 years if Europe would eradicate all housing inadequacies, counting health costs and savings alone. The question is to my presenters that do we have similar scale at local and regional level that we could share? It's a question for all of our three presenters. Is there anyone who
I've raised my hand,
Yes,
Gabor.
Yeah, I saw your hand.
Well, it's a very interesting question. I think this is like the golden bullet that everyone is looking for. What we found in our project in the municipality of Groningen is that it's very contextual. And contextual, I would first of all, if you try to make societal cost-benefit analysis of actually addressing these poor homes to become a better, more sustainable and save energy, the question first is, do you have an idea of the costs that individual homes, the costs that are associated with improving the conditions of these individual homes? I think that was one of the topics of our study at first, because we had to transform a whole neighborhood to become a positive energy district. And we saw that the individual business cases of these homeowners was actually not good enough. They had to invest more than they would actually save in terms of money. But we certainly we decided that this was not good enough. The societal cost-benefit analysis was more interesting in that case, because the cost of doing nothing were actually far higher. When we started to address how much money could be saved, or I would not say saved, but not be spent in future, I think that's where the quantification of the effects came into play. And this, I must admit, has taken us more than 2 years to get a good grip on which budget items will change as a result of addressing energy poverty, and preventing that these other side effects come into play or could be limited. And I think here we really dug deep into the municipal budget for that specific neighborhood. And of course, budgets are never made to be divided into neighborhoods or individual interventions. So the quantification was really, really, really difficult. And the best that we've done is that we've made a societal cost benefit tool that we basically we put in the data ourselves. And of course, we had ideas from the studies that we have used about the size of effects. But the actual quantification is something that you need to do with the individual people responsible for their budgets. And often they did not have a good clue of a doubling in size of a certain problem, how much more money would they need in their programs. And they would not let themselves be allowed into putting numbers in that would not make any sense for them. So that was the difficult part. I think from a qualitative point, we made a causal change. From the quantitative point, we got to a point that people were not really able to assess the effects on their budget in their programs in a hypothetical scenario that energy poverty would double or triple. So I'm sorry that we couldn't give you more. That was our aim, but it was I think we tried it.
Joran, and at the same time, from Mireia Matencio, we get the information in the chat that there are some data for France, which could help for funds quantifying these kind of questions. Yes. Previously in the chat box, we get a message from William Baker to Rebecca, I guess, which shows that there are some report on social bond, which could be also social impact bond, which could be also helpful for the finalization of our report. So, Rebecca, if you can.
Thank you, William, for that, because with the social finance, I was checking about the social impact bonds in energy poverty. And what I heard, what I knew, it was that they tried to implement a social impact bond in energy poverty and fuel poverty in the United States some years ago, but at the end they decided not to launch it. But I will check that reference for sure. So thank you very much
For this comment. And András, you also get a question in the Q&A session, but of course you give the answer as well, but floor is yours.
Yeah, I hope I answered it in writing. I was thinking about it, and it was not clear to me if it was related to the Energy Efficiency Directive or the energy efficiency obligations. In the first case, it was shown as I wrote it in the chat box. It was shown as part of the policy background, which is a requirement that necessitates action. And if it was related to the energy efficiency obligation, I might have been unclear in my presentation, because I meant that I said that it's well suited, but it's not the correct word. I meant this is an obligation that can affect all kind of households. I hope it clear now.
Thank you, András. Is there any more question or comment? You can share your thoughts in the chat box or also in the Q&A session. If somebody would share something more with us. It seems nobody writing. The Q&A. Anna Bajoni also had a question. maybe you can see in the Q&A session the question. The question is, have you considered the debt status of flat owners in this project? If so, what mechanisms or criteria were used to include or support indebted households? The second question is, have you considered measurable health outcomes from addressing summer energy poverty? If yes, what methodology or evidence-based was used? And the third question is, what specific weatherization measures are part of the strategy to combat summer energy poverty? And the last one, I guess, regarding the bonds, is there a risk that social bond investors avoid riskier person, for example, with outstanding debt or rundown homes that are harder to renovate? If so, what are in place to ensure inclusiveness of vulnerable groups? I guess, Rebecca, at least the last question is for you.
Yeah, can you, Gabor, just tell me where the questions are, because I'm here in the chat and I can see.
Okay, next to the share button, you can see a Q&A button in the right hand. If you click on, then you will have 3 tabs in the top, and open and answered and dismissed question. The open question is.
I have the chat.
Not the chat, it's a Q&A button. But I can.
Oh, here it is.
Okay. Thank you.
I would like to ask, I have considered debt status flat owners regarding the bonds. Is there a risk that social impact will avoid? Yeah, this is yes. The question that what you say is that, is there a risk that the social bond investors avoid riskier, also most vulnerable person? Yes, this is one of the main risks, and it's called cherry picking. It's what it happens is that, of course, since you will get paid if the outcomes are achieved, so that means that it's successful. It might so happen that if the bond is not well designed, that you will only do the interventions in the people that you know that it's most probably to give you good results. So the risk is that the people most in need or the most vulnerable, they don't get this intervention, or they might be somehow excluded because they will not be the ones that will give the good outcomes. So yes, of course, this is one of the problems. And here, of course, it depends on how the social impact bond is designed and how it's implemented and how the measurement of success is defined. So yes, it is a risk, and it is it's a question of concern.
Thank you. And there was some other questions in this Q&A session as well. You do not need to answer now in the discussion, but if you write an email to Anna, it's also a solution to have an answer. It's about the measurement of health issues in warm flats.
I think question 2 is the big elephant in the room. It's something we all want to know, whether it's summer or winter. And I'm afraid there are not enough longitudinal studies that are there to support the evidence where certain groups where interventions have taken place and other groups where interventions have not taken place, and that you can compare health outcomes. I'm aware of the need for those studies, and unfortunately, I'm not aware that already many have been executed. And I would really like to know the answers. I think, as we all want to know the answer to those studies, because that would really be very helpful. I'm aware that, basically you should start to look for natural experiments where by accident half of a certain neighborhood there have been interventions, and the other half there have not been no interventions. You can compare health data, but it's really difficult to find those natural experiments that you can follow over an amount of time, and you have people that actually have come back to those neighborhoods, so you're still talking about the same people. So this is really like the thing we are all waiting for.
Yeah. Rebecca, would you add something else, or no? Not now. And we have another question from Corentin Girard, and that it's asking that how these energy saving certificates is working comparing to the tools we already discussed today. András, maybe the question is for you.
Yeah. Thank you for a question. Unfortunately, these specific examples are not included in our study. We are aware that our research was not fully comprehensive, so many good practices might have been excluded. We will check if we have time to extend the study with these specific existing tools.
Thank you. Thank you for a comment and for the information you shared with us. And it seems that we reached the time and we reached the end of the questions now. Of course, if you have some more questions afterwards, you can share it with us by email. All of the participants will get the presentation, and you will have the email addresses on the presentation. So if you have any more ideas to share with us, then highly welcome. Now it's time for the last session, which is just speaking about the future and some wrap-ups. So just to summarize what how the three presentation is linked to each other. As you can see in András' presentation, there are lots of possible financial interventions for health-oriented energy parity programs especially in local level. For different target groups and different purposes and for different level, there are different solutions which is highly discussed in the literature. So there's a kind of collection and comparison of these kind of solutions. So they exist, but usually there is two limitations.
Sorry, we cannot see your screen.
You read my screen as well. Sorry. First of all. This. And now you can see it.
Yes, thanks.
So you can see that the first presentation was a collection of possible solutions, but usually there is two limitations to solve. The first question is the financial limitation. So local level needs to have some financial instrument to spend in these programs. So the question is there resource in our budget to finance such a program? And the other limitation is a kind of institutional incentive limitation for decision makers and of course for investors as well. That is it worth to finance such programs? So about these two limitations, Rebecca's presentation about the social impact bond is give us a possible solution for the financial limitation issue. So private sources could collect for energy poverty programs if we can convince the investors to invest in such a programs. And what Joram's presentation showed that this urban financial metabolism is a kind of solution which help us not just convincing the decision makers that social investment on these programs is useful at the social level, but also useful at the local budget level. So this was somehow the circle in this presentation, but we show today. And thanks for all the questions and comments that what other information could be built into our deliverable in this research. We will do that. And finally, now it's time to move on the final 5 minutes, which is just highlighting three possible connection to WELLBASED project in the future. First of all, we presented a manifesto in the spring, which is already signed by 13 cities from 7 countries. This manifesto is this manifesto is presented the willingness of cities to focus on health-connected energy poverty programs because they recognize that this is a kind of problem which have to be solved at local level. So if you or one of your connections have such a intention to join this manifesto, we are highly welcome to join us. You can see that it is available at the WELLBASED website to join this manifesto. We will have 2 more events in the forthcoming months. First, in the 2nd of December in Brussels, there is the Right to Energy Forum, and we will have a WELLBASED session on this forum. It will discuss the critical intersection of energy poverty and public health policies. You can see the agenda and you can register in the WELLBASED website as well. It's very easy to find in the website, not just this very complicated URL, you can use it, but you will see it. And finally, we have a final event in 20th of February in Valencia. It's an event when we will show not just the results of the research, but also our Paris recommendations, and we will have some interesting discussion with stakeholders there. So if any one of you is able to join us in Valencia, then highly welcome to come and discuss these issues there. So this was our time for discussion. Is there any comment or question? I see something in the chat box. Elena. Elena just answered the question for the what Anna Vajomi raised about the summer energy poverty and health issues. It will be integrated in the memo of the discussion, and you will see it afterwards. So, is there anyone some more comments or questions to discuss now? If not, then we will meet to each other in the forthcoming events. And thank you for all coming today and discussing these interesting issues. Presentation will be available for the participants. Thank you very much, and bye.